Well, this is great. It's great to have an opportunity to share what we've been doing here, and it's a pretty exciting time because the center just officially launched early January. So there's been a lot that, behind the scenes, the background leading up to it, which I will talk about, and then we can talk a bit about what the center actually looks like now. So you can see from the front slide, I've never done this before, a virtual kind of presentation, so it's odd, but the name of the center is NaviCare, SoinsNavi. It's a New Brunswick navigation center for children with complex health conditions. And I'm going to just go over some of the background and goals to sort of situate how the center came into being and what stages we went through to develop the center. And then I'll talk a bit about what the center looks like now and how we're moving forward. So in terms of background, back in 2014, Dr. Shelley Doucette and Dr. Rima Azar were awarded a significant grant from the New Brunswick Children's Foundation, and this was to look at improving health outcomes for children in the province, and specifically focusing on children with complex health conditions, which we very broadly define as children having one or more chronic physical, emotional, developmental, or behavioral conditions. We know that approximately 15 to 18% of North American children have a complex health condition, and this definitely impacts their daily lives. Often these children require services from multiple providers, and not just within healthcare, but across, education, social services as well. And of course, caring for a child with a complex health condition is extremely challenging, and particularly so if services are unavailable or if there are barriers and gaps to accessing these services. So the goals that we were moving forward with in terms of the development of what was then called a virtual center included helping to improve access to care for children with complex health conditions, facilitating the integration of health, education, and social services for children with complex health conditions. And of course, this is recognizing that health crosses all kinds of different sectors in terms of how the services that people need to access and where health care is delivered. Advocating for children with complex health conditions and their families, and then being able to offer children and their families, who really are the experts of their own lives and their situations, a place, a setting to voice their needs and to mentor and support other children and families. So in terms of the development of the center, there were a few things that have gone into sort of informing how this center came into being what it is today, which is NaviCare, SoinsNavi. And it started, there's been a number of site visits that have taken place. Shelley and Rima and myself have visited a variety of different navigation centers across both Canada, the United States, and even in Europe, and as well as like children's hospitals, to see how different models of care have been set up to improve health outcomes for children with complex health conditions. We've also done some research to help inform the development of the center, and I'm going to speak in more detail to these. The first would involve, or did involve, a needs assessment in New Brunswick, as well as an environmental scan of services available in the province. And the second piece was an environmental scan of pediatric patient navigation models in Canada. So I'll talk about the needs assessment and scan of services first. So for the needs assessment, it was recognized that if we're going to develop some sort of center, we have to talk to people to find out, what they want, what their experiences are, and where they see the current gaps and barriers, so that we know what we actually need to put in place to be, meaningful and useful. We conducted 120 interviews with families and stakeholders came from a number of different sectors, including healthcare, education, as well as social services. The interviews were all semi-structured, qualitative, allowing people to really speak to their experiences, and so we could get some nice, rich information there. In terms of the scan that complemented the needs assessment piece, this was to sort of give us a snapshot of the services, the current services and programs, resources that exist in the province, and this went across, public, private, not-for-profit, try and get a sense of eligibility requirement, wait times, how people get referred to them, is there a cost involved, that sort of thing. Coming out of this, we identified a number of gaps and barriers that do in fact exist. Some of them revolve around policy and procedures, so this could come from how programs are funded, what the mandate of the programs are in terms of then who's eligible, whether there's a fee for service or some such thing. Referrals and wait times were something that came up quite regularly. So how do people get access to some programs? They maybe need to be referred by a care provider. That can be a barrier. And then, of course, the waiting to get into a program. Geographical location. In a province where about half our population live in rural areas, where things are located can really provide or be a barrier in terms of accessing certain services. A number of the programs or resources are only available in some of the more urban settings, which means that travel can become a barrier, the cost, taking time off work, that sort of thing. Awareness. There's a lot of stuff available out there, but both families and care providers commented on the fact that it's really hard to know what is available, where it's available, and then how you access it. So just that knowledge piece. Lack of specialty services. So, you know, the first thing that we know here in New Brunswick is we don't have a children's hospital. So we don't have that sort of service available here, which means people have to travel, but it can also refer to specialists, say certain pediatric specialists that we may have only a few, or where they're located in the province. So it can make it difficult in terms of accessing care. Families felt that they really needed more support, but support both financially and emotionally. And again, it came up across from the families as well as the stakeholder interviews that navigation, being able to have some help finding access not just to any service but an appropriate resource or a program in a timely fashion. And where families felt that they needed some assistance doing this, stakeholders were feeling that they weren't necessarily well equipped to do it, but they were being called on to do this. So this came up again and again in the interviews. All right, so then the other piece that helped to inform the development of NaviCare was an environmental scan of pediatric patient navigation models in Canada. And what we were looking at here was to sort of get, not necessarily do a complete, you know, inventory of everything out there, and because that was quite challenging, but to sort of get a sense of the diversity of the models of care that exist in Canada, and to get a sense of what's been done, what works, what different populations are being targeted, and how programs were being delivered. And so what we found was that models tended to vary by condition or disease type, and for the most part, most of the models were very much like they would target, say, mental health and addictions, or a transition piece, whether for diabetes or sickle cell anemia, or a navigation. I spoke to some people who work with medically complex children. The only ones that were much more broader in scope in terms of condition or disease type, so they would work with any condition or disease type, were primarily the Aboriginal navigators, who typically worked in hospital and would work with any family that was brought into the hospital. So in that case, there wasn't a specific condition or disease type. Locations, so some of the navigation models were located in hospital, while others were located in the community. Some of them focused on helping people transition, say in the case of pediatric oncology navigators. They would help transition from hospital to community. Some specifically just work with families within the community, so the location varied depending again on the goals of the program. Navigator credentials also varied. So there were registered nurses, social workers, in some cases specifically, and with some of the mental health models I looked at, they might have degrees in counseling, psychology, but a number of them also used parents with lived experience. So peer navigators who had experience with that particular, say, condition type. So one program I looked at that worked with mental health and addictions issues, they very much felt that families, parents with lived experience were very beneficial in terms of helping with navigation. And then the method of delivery varied as well, depending on what the goals of the model were. So if in one particular case working with young people transitioning to adult care, there might be email and telephone, but a lot of Facebook messaging was used in terms of communicating with young people. If it was an in-hospital program, it would be almost all face-to-face, and then there were a number of virtual programs as well that were primarily phone and email. Now, in terms of Navigator roles, this seemed to be pretty consistent across all the different models that we looked at. I mean, education is a very important piece, as well as supporting parents, and then really helping families find access resources that are both appropriate and then in a timely fashion. So we sort of, gathered all this information together and came up with this, our own sort of center, which is a virtual center in that our model is being delivered through mostly over the phone, and there's some email. And because we're in New Brunswick, we have a bilingual navigation center that we have set up for children with complex health conditions, aged 19 and under. The services are free of charge and available Monday to Friday from 9 a.m. to 5 p.m. So we did go with a patient navigator, and we hired a registered nurse for this position, and we currently have one navigator. And this navigator is they're tasked to help coordinate patient care, connect families with resources, and these can be resources in their communities, in the province, and maybe even outside of the province if necessary. The navigator will advocate on families' behalf, help families understand the different services available across health, education, and social services, act as a resource also for the care team, and this was an important piece, that it isn't necessarily just a place for families to call, but care providers can also use the navigator as a resource to help the families under their care. Our patient navigator will also do site visits, and this is really two reasons: to both kind of promote the center, inform clinicians, to inform other care providers about what we're doing, but also as an outreach piece. So visiting more marginalized communities and building trust and relationships so that they can, we can make sure that the center reflects their needs as well. And finally, something that we all felt was really important in terms of developing and implementing the center was having a family advisory council in place, which we currently have about 5 members, and the advisory council will support the navigator, but also support the research team in terms of moving forward and helping the center evolve and so grow and develop in a meaningful way. Now finally, just a little bit on where we're moving now with the evaluation. So we want to make sure that we're doing what we say we want to do, and that we that as the center grows, that we actually reflect what families and care providers see as an important part of the services we provide. So we're going to be doing semi-structured interviews with families, patients, and care providers. Questions will be around the satisfaction piece with the navigator, satisfaction from the referrals that are made to services and programs, questions around education and knowledge, improving those things around what exists in terms of programs and services in the province, how having access to a navigator can affect things like quality of life, and improving care coordination. And we're just starting this piece now, and so this is pretty exciting, as we've had some families start to come through the center, and they've agreed to participate, so this is pretty exciting. We're also going to do a case study, and this will be a little more in-depth. We're going to be doing in-depth longitudinal qualitative analysis, and we'll be focusing on the experiences of 5 families who use the center, so this will be a lot more rich, detailed data that we'll be getting from that. All right, so I'll leave it there, and then if there are any questions, I can hopefully answer them.
Thanks very much, Allison. So any thoughts or questions from the group?
It's Anna Cooper. Just a related question. Your family advisory network, did you start this from scratch just for this project, or was this something that you had already up and running?
We started it, we didn't have it up and running. So it was something that as we were sort of doing the research piece and looking at developing the center, we all agreed it would be an important component. So we started by looking at people who had, some of the families who had participated in that early needs assessment phase. And a number of them agreed to sit on the Family Advisory Committee. So that's where it came into being.
Thank you.
And this is Lisa. I'm sorry, you might have said this and I missed it. Do the families, are they referred from somebody to you, or anybody can just come and ask for your help? Or
it can be either. Right now, it's families might hear about it. So for instance, after we launched and there was all the sort of media attention, we had a number of families just call because they heard about it on the news. So it can be either or. It can be through referral. I would think that as we become more sort of known and integrated into different, maybe with different clinicians or different care providers, that there may be more referral that happens. But right now, it's anyone can call, or somebody could refer a family. So either way, it works.
It's Mary Ellen here. May I ask a question?
Oh, sure.
I'm sorry, I didn't quite understand. So this is, I guess, related to the last question about referral and how people access the patient navigator. How does the navigator work with primary care physicians or primary care pediatricians, who are the main care provider for these kids and families?
Well, currently, because we're new, I mean, one of the pieces of the site visits will be that the navigator, as well as, I mean, Jennifer, you'll be probably doing some of this, and in terms of site visits, will be making contact with physicians, pediatricians, so that they know what we're doing, in which case they themselves could call to ask for resources, or they could refer someone to the center. So we're hoping that as we become better known in the province, what we're offering, that there will be referral that will happen, and that's a big piece of what we need to do now, is to raise awareness about what we're doing.
And
does that answer your question?
I guess I would just, what do you mean by a site visit? What sites do you visit?
Oh, well, we're looking at a number of different places. So, for instance, doing a visit at, say, some of the health clinics that we have on the different reserves around the province, to meet with both, it could be with families, but with healthcare providers there, so that to do a presentation about what it is we're doing, and to talk about the service that the navigator can provide, and so that those links are made. So it could be that kind of site visit, or make contact with different pediatricians in the province. So I think we're in the process of setting up something where we could visit a hospital. And Shelley, you were talking about this, going on rounds with...
That's right, yeah. We've, even prior to setting up the center, part of our needs assessment was meeting with primary care providers as well as pediatricians to learn about what the needs are from their perspective. So at that time, we gave them a heads up about what we were planning. But now what we're doing is we're starting to follow up with the pediatricians, and when they have their grand rounds, we're meeting with them to tell them about the service that's now been launched and how they can use the service to refer their patients, but also how they can use the service for themselves. So if they have a child in their care and they're not sure about what services or programs are available, we're going to explain to the care providers how to use the service as a care provider as well.
Thank you.
This is Lisa. Is there a way for people to sort of, do you have, can they navigate around your website and look for things themselves, or is it more streamlined if they just go through the navigator, like through an individual, to point them in the right direction?
Yeah, currently we don't have the resources list, I mean, we have a website, but to learn about the different resources or services that are available, you would have to go through the Navigator. So we don't sort of have an online repository of all that stuff. We keep that for the Navigator's use.
Okay.
We are in the process, though, of working on that because we do have quite a couple that we plan to put on the website. That's probably one of the last things that we need to really update on our website. But we also have a Facebook page, and our patient navigator has been really good at making sure about putting relevant posts or, say, a new program's coming up in the province, or if an event is coming up related to children with complex health conditions. So we use that as a resource for children and families that they can access asynchronously through online. But over time, we can add more to the website.
Yeah, and the great thing about the Facebook page, too, and I should have mentioned this earlier, is families can then also share, you know, information when they learn about an event or a new program or something, and it's a great place for sharing of information.
And this was started with a large grant. Now, is there a way to keep this sustainable? That's always the big question. Yeah.
Yeah.
That's certainly the hope. We have a close relationship with government, and they're really interested in what we're doing, but of course we have to demonstrate that there's a benefit.
Right, yeah.
And so that's why Allison's role is so critical as part of the evaluation, is we need to demonstrate the benefits to the center, which will help with the sustainability. But aside from that, we're already starting to look at other ways to sustain it on our own, even if it were not to become government funded. Mm-hmm. So looking at grants to help sustain the program into the future beyond the duration of our grant. But also we could even potentially get renewable funding from the primary grant awardee as well.
Right.
And that's assuming, like, we have to make sure that this is something that's beneficial too.
Right.
Like, yes, we're definitely looking at sustainability, but we're also making sure that the center that we're implementing, you know, is worth sustaining as well. So that's all part of it. Like, of course, we want to sustain it, but we have to make sure that it's worth sustaining as well. And we anticipate it will be.
Yeah, exactly.
Yeah.
All right, and just another question about, you said maybe going to the reserves to talk to community health there. So there's no sort of conflict between sort of provincial health and then federally funded like Inuit health or First Nations or Aboriginal health sort of stuff?
Yeah, that is a good point, and you're right. That would probably be a wrinkle that needs to be ironed out. I am not sure how that works. I'm aware of it but I don't.
I can jump in there. Currently, though, the program is funded through a nonprofit organization. It's not government funded, so currently there are no issues in terms of provincial or federal funding.
Great.
Right, so it would be available to everybody.
Yeah.
Absolutely. And to other minority groups like either new immigrants or refugees,
right.
Well, obviously to everyone.
Yeah.
Which makes sense. Any other thoughts or questions or comments, suggestions?
I have a question myself. It's Shelley.
Yeah.
I'm wondering if anyone else on the call here has experience implementing patient navigation programs, either for children with complex health conditions or just in any population.
Well, I guess the silence is kind of. I think.
Well, if there's no one from
go ahead.
Ottawa, it's Mary Ellen again. I understand Ottawa has a patient navigation program. Yes. If there's no one on, could I ask our presenter to did they connect with them and talk about it? Like when they.
Are you talking about the program? Is it CHIO?
Yeah, it's CHIO.
The Navigate. Yes, I spoke with.
We did.
They were included.
So I know that there's our they're complementary between their complex medical care coordination
Yep.
that they do at the hospital and their patient navigation, their complementary work. I'm just wondering, if you have complementary or partners, even though, as you said, you don't have a pediatric program, but
yeah, because we don't sort of have a similar setup, and like you said, their patient navigation program is very much set up in line with what was going on through the complex care center, correct? And yeah, we don't really have that sort of setup, do we? Shelley, Rima, can you?
No, our main partnership right now is I don't know if I think most provinces have a telecare program. Like in our province, it's 811 telecare is. So we've partnered with telecare to offer this service. So we're actually, the funding that we have through the Brunswick Children's Foundation, we're using that to contract out a company called SoinsNavi, and they're the company that delivers telecare through the government of New Brunswick. And so we've partnered with them, and they've been a great resource in terms of gaining access to lots of different resources and services across the province. So that would be our main partnership.
All right.
thank you.
Okay, so maybe we'll we've recorded the presentation, and we will post it so people can share this. And I think that if we have any other questions or comments, or we can reach out to Allison and Shelley and Rima and ask questions. I'm sure they'll be open to that. And
oh, for sure.
And if you have questions for us, certainly stay connected with us and ask away. We're trying to develop some recommendations for sort of the care of children and youth with medical complexity, and so navigation and key workers and that sort of support and care plans. It's all a big factor in this. So it's really interesting to see how you can sort of deal with some of those big issues of navigation in a province like New Brunswick that's, you know, without a children's program, and with all the sort of rural families. So it's a great model, I think, and I wish you lots of luck, and look forward to hearing more about it as things progress.
Thank you very much.
Well, thank you.
Thank you for your support.
Thank you, Lisa.
All right.